Achilles tendon pain. Your Achilles tendon is made up of primarily the two big calf muscles that make up your gastrocnemius and the soleus muscle, which doesn't cross over the back of the knee. They come together to form the Achilles tendon, and it inserts into this plateau on the back of your heel. Finding what type of Achilles tendon pain you have really differentiates what type of treatment you have. It's more commonly termed tendinopathy now rather than tendonitis, because there's no actual swelling or inflammation or itis going on within the tendon. It tends to be a tractional pull that's hurting the tendon. So one of the common ones you have is a swelling or a nodule about an inch or so above your actual heel bone. What causes that is the traction of your knee pulling against your foot pulls the Achilles apart. Now, something that causes that to pull in the wrong direction at the wrong time, or more than it's used to, may damage the actual tendon. The tendon's in about 20% of damage repair all the time, so it's always a little bit damaged and it needs to be going through that repair cycle to work properly. What happens if you don't exercise it in the right way, I don't mean going out for a run, I mean exercising the tendon in the right way, is you start to produce a less elastic material than you do than the collagen you require for the actual Achilles tendon to work. That forms a nodule. The itis bit, or the inflammation, often comes after that, where the nodule irritates the surrounding soft tissue and it starts to inflame, and often that's the most painful part, even more than the nodule itself. You can get Achilles pains which are inflammation. There are bursas or fluid-filled sacs, cushions effectively between different parts of it. They can become inflamed. There are nerves that run either side. They can become injured. Crucially, often people will say put a heel lift in for an Achilles tendon problem. If you have a nodule type problem, that's not the best thing to do. You need to work out what's causing that. If you have pain right on the very top surface, that's actually compressional rather than tractional, so there's a crushing type thing going on, so we're probably looking at different treatments for that type of thing. But there is no one size fits all treatment for an Achilles tendon problem.